In the vast canvas of southern Nigeria lies Osun State, a region confronting the grim reality of childhood mortality. Pneumonia, diarrhea, and malaria claim the lives of thousands of innocent children every year. In this documentary, we immerse ourselves in the just concluded project, striving to rewrite the heartbreaking tale. Nigeria, contributing significantly to the global under-5 mortality, is the battleground. Osun State, with its 5.69 million souls, is where the narrative unfolds. The journey began in February 2023 as a beacon of hope emerged, the IMCI/ICCM training on pneumonia, diarrhea, and malaria management in Osun State, funded by the Pfizer Foundation Global Health Initiative Grant Round 7. Its mission? To optimize the protection, prevention, diagnosis, and treatment of pneumonia, diarrhea, and malaria in Osun State by strengthening infrastructure at selected primary health care centers for effective control of PDM, strengthening the capacity of community health care workers in PHCs to deliver high-quality PDM prevention, diagnosis, and treatment services, to increase knowledge and acceptance of PDM prevention, diagnosis, and treatment interventions at the community level, influencing the policy environment on improved protection, prevention, diagnosis, and treatment of PDM in Osun State. In a span of 12 months, this venture raced against time, aiming to wrap up its transformative mission by 2024.
So the general idea behind the GHIG project in Osun State centers around the integrated community case management, target diseases, which are pneumonia, diarrhea, and malaria, because they are major causes of mortality in under 5 children in sub-Saharan Africa. Nigeria accounts for about 14% of global malaria mortality for under 5s, according to WHO, while Nigeria also contributes about 15% of mortality due to diarrhea. For pneumonia cases, we have over 130,000 children who die annually from this disease. This high morbidity and mortality are highest especially in rural areas and is driven by poor access to healthcare, social services, sanitation, and clean water.
The project's lens focused on community healthcare workers, under 5 children, and their caregivers in the 30 local government areas of Osun State.
Why Osun State? Osun State is in southwestern Nigeria with an estimated population of about 5.7 million people by 2022. And then it has a population of about 1 million children under 5s. And mortality rate for 2016, according to the MIX report, puts the death at 78 per every 1,000. Now, the Pfizer Foundation, the Global Health Innovation Grant Round 7 in Osun State targets the improvement of the control and treatment of pneumonia, diarrhea, and malaria for under 5s through the integration into the state health immunization program and community-based activities. We targeted pneumonia, diarrhea, and malaria control in Osun State, looking at poor health-seeking behavior by the populace due to religious beliefs, use of traditional African medicines for ICM target diseases, poor attitude and knowledge of healthcare workers, especially at the PHCs. We also looked at poor monitoring and evaluation mechanisms that did not allow for proper reporting and all of that. We had issues around dilapidated health infrastructure, inadequate health care commodities and consumables. Most of these infrastructures in the rural areas are in pretty bad shape.
What sets this project apart? It's the integration of ICCM into routine immunization activities. Trained healthcare workers become educators at immunization clinics, reaching caregivers with crucial information on prevention, recognizing danger signs, and guiding them to appropriate care channels.
About Pfizer program, a lọ fún training ní Ìròjò PAC, Ilesha East. So fún diarrhea, pneumonia and malaria for under 5 years of age for children. So a dẹ̀ dúpẹ́ lọ́wọ́ Ọlọ́run fún program yẹn láti ìgbà tá a ti bẹ̀rẹ̀ àárín àwọn ọmọ fún malaria, fún pneumonia, fún diarrhea. For example, fún malaria, tá bá gbọ́ ọmọ wá fún wa pé ó ní malaria, tá bá ti diagnose ẹ̀ pẹ̀lú IVT, tó bá ti positive, a máa diagnose ẹ̀ lórí àwọn oògùn tó yẹ ká fún bíi AL1, maybe AL1 or AL2. Eléyìí tí pẹ̀lú age àti weight ẹ̀ ló máa determine oògùn tá máa fún.
From stakeholder analysis to high-level advocacy meetings, the project left no stone unturned. A technical advisory group, TAG, was established, and primary healthcare centers were meticulously chosen. A situational analysis identifying gaps and focal persons were engaged to coordinate these interventions. By September 2023, 133,697 under 5 children in the state have been reached through preventive messages to caregivers and care and treatment support by health providers, both at the health facility and in the community. The success that was achieved in just 8 months offered comprehensive PDM protection and services. Leveraging the high ownership of phones among mothers, scripted ICCM messages were deployed via SMS, reaching caregivers where they are. An effective monitoring and evaluation system that encompassed regular data collection, monthly cluster and data validation meetings with PHCs and local government M&E offices were organized. The system also integrated coaching and supportive supervision visits to the 60 selected PHCs, on-the-job trainings for PHC staff, and a dedicated commitment to ensuring accountability in the 30 local government areas of the state. By January 2024, the project strengthened the capacity of 210 healthcare providers, 120 frontline health workers in PHCs, 60 corps, and 30 LGA health educators.
Mo discover wípé ara wọn ó ń gbóná, ó ti wá gbígbóná yẹn tí ń pọ̀ jù, so mo gbé wọn wá sí health center láti wá complain fún wọn. Nípa oore ọ̀fẹ́ Ọlọ́run bá mi fún àwọn ọmọ mi ní àlàáfíà.
Oṣù mẹ́rin sẹ́yìn mo gbé ọmọ mi wá sí center primary school Ìfẹ́tẹ̀dó, ó ń yàgbẹ́ burú, wọ́n sì bá mi tọ́jú ẹ̀, ààrẹ sì yá.
Nígbà tí mo gbé wá bí wọ́n ṣàyẹ̀wò fún ṣùgbọ́n tó fún ní àwọn oògùn tí wọ́n kó fún wa, ó sì ṣiṣẹ́, ó sì bá lára mu, ara ẹ̀ sì ti balẹ̀ dáadáa.
There is no any children that are not recovering. They are used to recover when they came back for a visit. Pfizer Foundation, we appreciate you for doing this. We highly appreciate you once again for your effort and for your help.
Reflecting on our journey to optimize the protection, prevention, diagnosis, and treatment of ICCM targeted disease through integration into the state health immunization program and community-based activities, This strategic initiative reinforces our dedication to creating a lasting positive impact in the community.
Progress so far include the fact that we have trained 120 clinicians across 60 PHCs in all of the 30 local governments. Of course, we selected 60 PHCs at the start of the project, 2 from each local government. We're also able to train health educators, 1 each from each of the 30 local governments. We trained M&E staff from each of the 60 PHCs. We trained community resource persons, 1 attached to each of the PHCs across the entire local government within the state. Then we've gone ahead to also establish the technical advisory group made up of intellectuals and technical professionals within the primary healthcare board and across the state. Today, we've been able to reach over 100,000 under 5 children as at the end of November, and they've been provided with basic screening services for these 3 very critical target diseases: pneumonia, diarrhea, and malaria.
The fulfillment we derive is evident in the smiles of mothers, children, and healthcare workers.